Okay, so the question was though, upper thoracic, right? Is there an isometric technique that is better than the typical mobilization with movement in for upper thoracic? Which, if you want to demonstrate that on me, I knew exactly the technique you were talking about. It can be hard, right? It's a longer lever arm. It's a lot of work for you, especially for someone who's super stiff.
I mean, you can make it a hold relax. Like you can say, hey, gosh, that's, it's like, yeah, well, I mean, I've been doing a lot of flying lately. Okay, so what's the alternative?
I mean, you could do hold relax, like maybe,
Hold relax.
yeah, like push down,
And then relax,
Okay.
right?
so I can push down, and then at the moment of relaxation, you can push me in further. But a way easier technique is you sit now, and you're gonna cross your arms, let's like this, and put your forehead here. So I'm gonna put my hands, I can start on T1, and when I shift my weight from forward to backward, then he just leans forward, and also by leaning forward, by elevating his arms, now I'm doing zero work to lift his arms versus the other thing that you were doing. It's like a lot of work, right?
Yeah.
You're side bending, you're lifting his arms. Also, by doing this passively, these tissues are now relaxed. When I'm like this, my posterior chain is super tight, right? Because you're putting someone in a position where now my rhomboids and everything are tight, and you're bringing them up into extension versus doing this passively. All of those structures are actually slackened. So it's a lot less work for me. So the other cool thing about this, let's see, now all I have to do just a little bit of pressure, and I'm just shifting my weight back like this. So you can do this T1 all the way down to T4 or wherever you can reach. Add a little bit of side bending, a little bit of rotation, and then make this a little bit more unilateral. So I think this is a great technique, and I've even done this on maybe kyphotic little old ladies who are super stiff. It's just that maybe I'm only taking them to here, right? So that is one of my favorite variations. But then how do they hit that themselves? They can either do that maybe against the wall, but I would say the majority of the fancier techniques, they don't need to replicate themselves because patients often think, hey, how do I do that on myself? That technique might be great to desensitize them, but they just need to do either retraction and overpressure or that sustained or even repeated retraction and extension to hit that upper thoracic spine.